Costner. My outbreak summary focuses on the influenza pandemic in 1918. This pandemic is also commonly referred to as the Spanish flu. In 1918, World War I was coming to an end. However, soldiers were still being mobilized across North America and Europe. Additionally, Chinese workers were also traveling to and from Europe and North America, assisting with the war effort, which contributed to the spread of influenza in Asia. The influenza spread rapidly across Europe, North America, and Asia. In just 12 months, there were an estimated 500 million cases. The influenza in 1918 spread in 3 waves. The route of the first and second wave can be seen in this image. The red dots represent the suspected origins of the first waves, with the purple dashed lines showing the spread from there. The second wave shows origin locations in purple dots, with red lines representing the spread. The second wave of this pandemic was by far the most deadly and had the highest mortality and morbidity rates. It is estimated that at least 550 million people died as a result of the 1918 influenza pandemic. However, many estimate that number to be the minimum. Some guess the number was closer to 100 million deaths. This makes it the deadliest influenza pandemic in history. There are several factors that contributed to the increased virulence of the 1918 influenza. First, medical professionals did not know what was causing such a widespread, sudden onset of disease. Secondly, there were not effective treatments for influenza. There were no tests to determine infection, no antivirals, no ventilators for respiratory support, and no vaccines. A third factor contributing to the high death rate was the difficulty in slowing the spread. Cities were overcrowded and soldiers were in trenches together. Although some city officials tried to pass ordinances that would protect their citizens, like isolation protocols, closing of gatherings, places like schools and dance halls, and even mask mandates, these were not consistent and difficult to enforce. Finally, co-infections with bacteria also contributed to the high mortality rate during the 1918 pandemic. As scientists have continued to research this virus, they have found that many of the fatal cases had evidence of secondary bacterial infections caused by Streptococcus pneumoniae. Since antibiotics were also not available during this time period, those infected had difficulty fighting off these infections. This chart shows the death rates by age for influenza and pneumonia infections for the 7 years before the pandemic and during the pandemic. The blue line shows the death rate by age for influenza and pneumonia mortality in the years leading up to the pandemic. The red line represents the death rate during the pandemic. You can see the spike in deaths for those between 20 and 40 years old. Scientists now believe that a similar, less virulent strain of influenza was transmitted a few decades earlier, thus giving the older population an immunity during the 1918 pandemic that the younger generation did not have. In the 1930s, scientists finally got their eyes on a virus for the first time by using an electron microscope. The image shown here was taken with an electron microscope and colorized. It is a reconstruction of the virus that caused the 1918 pandemic. Scientists completed the sequencing genome in 2005. We now know this virus is influenza A H1N1. This knowledge helps plan and prevent future influenza pandemics. Scientists were able to put this research to the test during the H1N1 outbreak of 2009. Researchers noticed the similarities between this virus and the one from 1918, leading them to believe that young adults would again be the hardest hit. Because of this connection, vaccines were prioritized for young adults instead of the elderly, which was typical. In addition, doctors also knew from the research that secondary bacterial co-infections were common and could cause a lot of issues. This adjustment to typical treatment and knowledge regarding co-infections likely saved a lot of lives. Now we have influenza vaccines that are created yearly based on data collected worldwide that helps estimate which specific strains should be targeted by the vaccine. Treatments are not the only factor when considering how to avoid the next pandemic. Health education is also important when using vaccines as a means to prevent or slow infections. We can create the most effective vaccine in history, but if people aren't willing to take it, it's not nearly as effective. The flu of 1918 taught scientists and public health officials that it is important to consider the biological, social, and environmental factors when developing a plan for future outbreaks of influenza. Here is a list of the references I used to complete this project. Thank you for watching.